Good morning. I'd like to thank Mike and Roberta for allowing me to speak this morning, and I also truly would like to thank Roberta for accommodating my schedule. And it is my mother's birthday tonight, so I'm glad I can get back on time. We're going to talk about, this is going to sort of be a bridge between what you've heard in the last 2 days and what you're hearing today. We're going to look at volume as being the really most important thing, in my opinion, when you look at most aging faces. And you've heard it through the ideas of fillers, you've heard the ideas of fat. I'm going to touch upon both, but principally fat. We have to first understand what defines a youthful face, and that may sound a little ludicrous, but if you look at a lot of people where they just, in an a priori fashion, decide to lift brows, cut skin, pull faces, and not really start to look back at what exactly constitutes a youthful face, we oftentimes don't get closer, we get farther. And also what's so important is you're going to hear me, what I'm talking about today is using the old photographs of the patient as a blueprint and as a guide to understand what did that patient usually look like, where were the brows, what was the cheek looking like, what was the neckline looking like. So you know that principally, to break it down, there are obviously wrinkles, gravity, and volume. As surgeons, we probably look at gravity, and as dermatologists, probably looking at wrinkles. But there's this intersection, which is volume, and I think volume is so critical. It's really become the cornerstone to everything that I do. So let's talk about a new theory. I don't claim originality here, but I really merged some of what Dr. Donofrio and Dr. Glassgold have done and then just put it through this more intricate idea of looking at geometry. And this is the first time I'm presenting this information. If we look at a child, the child for the most part is a circle, and that's the idea that there's this simple geometry behind that face that allows us to make an immediate idea of what that person's age is before we can even look at wrinkles or gravity from a close range. Further on, as you're a teenager, that still maintains a very strong circular pattern. Of course, there are differences in people that are thinner, overweight, etc., but in general, there's a circular element to a teenage face. In our early 20s, we also maintain that circle, and that's that evolution that maintains itself until we get about the time in their mid-20s. And what you're starting to see at this point is some of the baby fat beginning to disappear, but not quite yet. So you're getting principally a circle with a little bit of the hint of that triangle coming through that heart-shaped face we talk about. As we get into our late 20s, the triangle begins to dominate, but the circle is still there. There's still fullness to that face. And that's also part of that evolution, is just beginning to transition over into the early to mid-30s where we see that triangle. And this is what's interesting, is that most women, and I say about 80%, would look at themselves and say they look the best in their early to mid-30s because there is a triangle. Some of that baby fat, which they conceptualize as being fatty or fat, is really something that they don't oftentimes like, and there's a sculpted look in the early to mid-30s. As we get into the late 30s and early 40s, there's a squaring off where that, what Dr. Lam was talking about, that the loss of volume into the mid-face just begins to start happening, and you start to get a little bit more dominance in the lower face, especially after some children. You may gain a few pounds, and so that begins to look like more like a square. As you get into the mid-40s and beyond, you start becoming still a square, but you get even more volume down here and more flattening of the upper mid-face. And I think what we're really looking at today is, it's not throwing the baby out with the bathwater. We don't have to do everything through volume, everything through suspension, everything through skin treatments. It's an amalgam of all that. I think if you look at where we're going and listening to Dr. Brandy and listening to Dr. Little, there's this consensus that the lower face is principally a suspensory element, and the upper to mid-face is more volume. But there is an intersection where still lifting is important for the upper face, and volume is still important for the lower face, but to a lesser extent. And that lower face starts to dominate. And as we get further, this is obviously excessive, but into the 60s and 70s, we truly get a lot of loss around the eyes. And you know, if you ask yourself in an extreme case like this, what would you brow lift? What would you cut? What steatoblephron is there? What are you going to take away? There's nothing left, and the lower face dominates. So we need to bring that back. You heard Dr. Little use the idea of an egg inversion. So this is just a different way of looking at that same idea. So what are we trying to do? Really, this is what Dr. Donofrio talks about, is inverting the triangle, getting it back toward a heart-shaped face or triangle, not necessarily a circle. But what's interesting, there was an article in the New York Times that came out, and they looked at where our modern current conceptions of beauty and ideal beauty are, and they're really closer to almost like a pubescent shape, which is maybe frightening to some. And that may be more of a male-dominated perspective, I don't know. But that's interesting that we're looking more toward a teenage to early 20s as an ideal beauty. But if you're working mainly to cater to women, they're not wanting that. If you talk to them, they say, come on, please, this is not what I'm looking for. It's just an idea just to have you conceptualize. So let's look at someone who's in her 50s and ask ourselves, why does she look so good? And if we start from the brow complex, the brow is tremendously low and full. It's almost the antithesis of what we think about brow rejuvenation is all about. We think about brow needing to go up, higher, sculpted. And even, I don't even do the little temporoplasties anymore or brow lifts. I really like a low full brow, and probably the majority of patients, about 95%. If you can see, that eyelid is actually hanging over the eye itself, but it looks tremendously youthful. And you have to start questioning. Go back and look at some textbooks, and these are the textbooks I ask you to consult. Glamour, Allure, and Vogue, because those are ideals of what we as a society look at as beautiful, not the textbooks that we have in terms of before and afters. And if you look at that, what I call the frame to the eye, there's a tremendously lush frame around the eye, and that frame begins evacuation over a period of time. There's that beautiful heart-shaped face, and there's a very similar shaped face if you look at her in her 30s. It just was a little bit fuller, a little bit closer to that circle. And if you look at, obviously, an extreme, obviously there's beautiful brow lifts we've seen, beautiful work. I'm not here to denigrate anything out there. This would be an extreme example of a lot of skin and fat removed in a brow lift. And if you think about it fundamentally, this has actually advanced the age further, because that evacuation loss around the frame of the eye is the hallmark of aging. And what we interpret as as hanging, dermatochalasis, and brow ptosis oftentimes is deflation. So just to rethink it, we're going to go through some of my before and afters to have you understand this. So it's really focusing on facial shape as the cornerstone of what I see as the aging process. And really, out of anything in the world, if the eyes look tired, we've done extremely little to rejuvenate a patient. Go back and look at the gestalt, look at the whole face, and don't micromanage the face. Look at the whole thing and says, that person actually looked better. And the cornerstone really is making those eyes really, really pop. So part of it is patient re-education. Almost every single female that comes into my practice starts with this move. Doctor, this bothers me right here. Because they think that is what ages them, and that's what they've been trained to think. It's a little bit of wrinkles around the mouth, it's a little nasolabial fold, and that's oftentimes not the case. And the reason is, you have to understand, is from a male perspective, why we don't get it, is that when makeup is applied, they're extremely close to the mirror, and so every little minor cutaneous flaw becomes the importance for them. But it doesn't make them look better after I fill these tiny little folds. Sometimes yes, sometimes no, but we have to start looking at going back and going, what is the impact? Oftentimes my analysis of the patient starts at 5 feet. I rarely get up and close and try to look at what little things are, because they are not that important for overall. So it's a patient re-education that's so important. And then starting with the old photographs, as I was hinting at. So this is, you've probably heard before, I give credit to Dr. Nye, came up with this idea that when we're young, we're a grape. Over time, we become a raisin. So why should you take that raisin, cut, pull, stretch it, and lift it until it becomes a pea? Because a pea doesn't look like a grape. A grape looks like a grape. Obviously, a reductionist philosophy, but one that helps you sort of encapsulate the thinking here. So we're going to talk about some of the technical details. For those that want to do this procedure, as you know, I have a book out there that goes through more detail. This is from my textbook for the book, and it just shows you really the key. And you see a lot of it is just around the eyes and a little bit of pre-jowl, but really around the eyes and cheeks. That's your home run. That's where, if you do a facelift, if you're in a surgical practice, this is going to get you really closer to a magical result where it's just a wow. That's what I'm shooting for. Not like, okay, technically it's better. It's just wow. And these are refinements, and all this is in the book. It's just idea of little things that you could add on if you wanted to get a little bit more of a result, and based on some of those aesthetic principles that you develop and that eye you develop over time. And then some areas that you may want to be careful with, like the temple, and really filling if someone's been over-resected in the upper eyelid, areas that are a little bit more scarred down and difficult to achieve consistently smooth results with. So, you know, what's interesting is that we're very visual people, right? Most of us are. But what's amazing with fat, for the most part, it's tactile. So I want to pull you away from this, is that it's going to be using the skull landmarks in your non-dominant hand as your principal guide, and then feeling where you are, and visualizing in your head more than what you see oftentimes. And that's very, very important. So this is just a schematic that's also in the book that just helps you conceptualize the layers. There are three principal layers: deep supraperiosteal injections, which are around the eye, and then sort of this general mid-subcutaneous deep fascial injection, and then sort of in the general lighter superficial subcutaneous plane. So point of care is easy. There are no dressings. There are nothing you put on. No sutures. I don't close any of these little stab incisions. Just using some ice and reducing your salt in Valsalva and excessive bending over. And then you can actually work out any of the areas you harvest, because it's such a gentle process. It will be sore. That's the area that people have the most soreness for about 4 to 5 days. Occasionally I've had a few people last even a month in the donor areas. So let's talk about the most important area. It's the eye. I think the oculoplastic surgeons can agree to this, and I think it's the area that really allows you to see the beauty of someone's face. So if we look at this lady, only 39 years old, she had a brow lift and upper eyelid at 32, and this is about 9 years out on the left side. And if you look at her intuitively, you look at that brow and you say, it's too heavy. Go ahead, doc, let's go ahead and cut some more. In fact, she was about on schedule to go and do another brow lift and more skin removal. But look at her face at 28. There is almost no supratarsal crease, and that brow is full. And the brow is not necessarily higher, it's fuller. And so what I did was I made it fuller to make it look less heavy. It's obviously retraining your eye. And if you look, you need to balance the cheek, because almost no one has this heavy brow and an empty cheek. But some people have a heavier cheek and empty brow. So it's understanding patterns in nature and trying to reproduce it. And then matching old photographs, you can see that heart-shaped face. I also did a little plasma resurfacing on her skin to help soften some of the laser demarcation from previous CO2. This is a lady 47 years old, and when I see the eyelid skin beginning to hang right at that ciliary margin, that's when I usually take a couple millimeters of skin off. I rarely take fat. Occasionally I take the medial fat pocket if it's really pronounced, and I don't do a brow. This is just filling it, and filling it really, really softly. There's no eye bag removal. This is just filling fat in the lower eyelid, and then this is and plasma resurfacing to help the skin a little bit. Part of the thing is that when I look at a face, I try to, about 10 out of 10 will get fat around the eyes. 1 out of 5 will get a upper eyelid, little bit of skin removal. And 1 out of 10 will get a transconj bleph with that. So I don't do a lot of transconj blephs. This is filling around the eye, and you can see that actually. Do you see that line on that upper eyelid I'm talking about? That's that line that I target. I hit that line and soften it. And then if you see her, actually her supratarsal crease has gone down, it's lowered. But that's, to me, more attractive than raising it, because it's a better frame. So just filling it in subtle areas creates a beautiful, beautiful look, in my opinion. And what you may see is dermatochalasis and brow ptosis, I see as deflation. And this is just filling that brow laterally and medially to create a better look. And this is when I was more focused on the lateral. You can probably see there's a little deficiency in the medial aspect, but not bad. This is a lady, if you look, she's got this almost negative vector looking eye, and really what would you do to cut this and lift it? Anything you do is going to make this eye stand out more. But by softening and framing it, it really creates a better look, and that cheek and jawline is really a nice support to the face. That's also a facelift. This is a lady that, if you look at that brow, she's only 41, she's already had a cut on the upper eyelid and brow lift, and I don't think that's an attractive look. It actually looks, she looks older than her age. And so by filling and pushing the brow back down and creating padding, I think I've created a softer look to the face. Let's talk about facial shape. Inverting the triangle. You heard me mention it earlier. This is a lady that, if you look at her, adding fat, I took a little bit of skin from the upper eyelids and added fat. She's a little undercorrected on the lower eyelid, but if you look at her, she looks slimmer. 46 years old, looks slimmer with fat. Almost ridiculous, right? But this is an aggressive anterior cheek and pre-jowl and chin fill and brow fill to create a slimmer looking face. Here's a 49-year-old lady who's had a brow lift, upper eyelid, facelift, lower eyelid, etc., traditional surgery, still looks quite tired. But what I found to be more attractive in creating her face was the exact opposite, to actually widen her face, to pull that out and create more volume in the right place. And a little bit of, I do use silicone, that's silicone lip enhancement. I don't like fat in the lips. And that's just creating a face that I think, even though it's fuller, is much softer, feminine, rested, and more youthful. And here's a lady who's already had a brow lift and eyelid surgery on the left at 56. Is that rested to you? Or is it just volume depleted? And this is just adding volume in all the right places to create a beautiful, soft look that's gorgeously feminine and rested. And here's a 55-year-old lady. I did a little silicone lip enhancement and then volume. And if you look at her eyes, you can see it's really what you may see is ptotic. I see as deflation. So it's just a different idea of perception. You must understand, in order to sell fat, quote unquote, to someone, you've got to believe it yourself. You've got to understand it, and you've got to be able to show it. And if you don't understand it, you won't be able to communicate that. Using old photographs and matching patients out. This is a lady on the left who's already had a large coronal brow lift and some eyelid work that, in my opinion, she still looks tired. This is a little mini facelift and adding fat in the right places, and she looks like her photo at 40. And it's just getting a face closer to a youthful ideal. That is their own ideal. Here is a 49-year-old lady who's had a lot of dermatoheliosis. Is that right? I learned a new word. And also some acne scars. This is what's amazing. She is on Accutane. Would you touch this patient? Am I crazy? But this whole thing is incisionless. And so this is showing you that over time there's even a softness that to the face without making a cut. I would not do a facelift on a person or a skin peeling on a person that had Accutane. But what's amazing is look at the face in her early to mid-20s. There's that triangularity that's there, and I reproduced it in the photo on the right. This is a frontal view. Here's a lady, 59 years old, bad chin implant I removed, and then adding volume, a little silicone lip enhancement. And if you take a look, I did take a little skin from the upper eyelids and a little chemical peel when I was still doing that. But if you look at the shape of the face, there's a better frame, and it looks closer to her face at 35. If you look at that upper eyelid in that small photograph, it's very full and low. So part of the idea to believe it is if you don't believe it, I want you to go back and look at your old photos. First, convince yourself before you convince someone else of this. And then restoring identity, understanding not to make someone look different. That's why the old photographs are so important. People are very frightened to walk out of the door and look like a different human being. Here's a lady that had a brow lift, upper eyelid, lower eyelid, cheek implants. And part of the reason I'm not a big fan of cheek implants for aging face is that it exacerbates transitions. We talked a large part of this of softening transitions. But if you're starting to get bony in the mid-face, I love chin implants, and I don't think there's a substitute. If you have microgenia to get predictable structural support to the lower face, I think a chin implant's critical. You can't do it with fat, otherwise you look like a fat chin. But I will use more chin implants. I rarely use mid-face augmentation with implants because it exacerbates infraorbital hollow and buccal hollow. And that's, in my opinion, a problem. So balancing and blending and softening transition. This is also removing the implants. And this is, as you see, the lines are not improved. Everyone's, oh, the lines should be improved, not with fat significantly. But this is, again, aggressive periorbital eyelid work that has led to, I think, worsening at a 55-year-old lady. And adding volume adds, you know, if you look at that skin texture, too, this is a year out, and you can really see these photographs show that there's almost better texture. And maybe that's stem cell, maybe it's not. You probably heard that bandied about. The other thing is, remember, there's just more light on the face. When you create volume, we live in a world with just overhead lights, right? We don't have flash. When I photograph my patients, it's uniform overhead lights, not the single light coming down, but uniform overhead lights in a controlled, non-ambient room setting. And that's what brings out that luster. When you see them walk through the door, you go, wow, from 20 feet away. It's volume. And improving results. Does fat go away? Everyone says it's going to disappear. It actually begins to sing about a year out. There's a lady, let's walk through this. This is 6 weeks out from a full face fat grafting, facelift, and she looks very, very soft, but you can see the edema. And then this is about 6 months out. And what's amazing with the photo on the right is she's had no sleep. Less than 1 hour sleep, but she still looks more rested. That's what's so powerful of volume. And this is now 14 months out, single treatment of fat, and you can see that there's this, I can't, you know, what is the difference? It just looks better. I can't put my finger on it. That's her photo at 35, where I think the cheeks are too big. I've actually not brought them that big because aesthetically you want to create a face that I think looks good. And actually, let me go back to that one point. Do you see when you go back and look at that upper eyelid, it looks heavy to you and low. I've made it so low that it's hanging over the eye. It looks like that Christy Brinkley photo. So to challenge your aesthetic vision today. Non-surgical alternatives. I totally agree with the trend that Dr. Lam was presenting today. It's volume, volume, volume. I rarely fill folds unless I feel it's encroaching on their aesthetic look. Here's a lady that came to me 2 weeks before her daughter's wedding and said, make me look great. Well, this is Juven around the eyes. I prefer now Restylane, but this is Juven around the eyes. A little bit of Restylane in the cheek. This was done last November, so before Perlane and all that. And I don't use Radius a lot only because I like to be able to transition my patient over to fat. This gives them an incredible preview of what fat can look like. This is 4 syringes. My standard is 4 for everyone. And this is a lady, 37 years old. On the left, that's the after. On the left, after injecting a syringe of Restylane into the nasolabial folds, and then a syringe of Restylane into the lips. I don't like the lip design, and I don't think she looks that refreshed. I came to her and said, let's do volume. That's 4 syringes, 1 cc Restylane per side, a half a cc of Perlane per cheek, and a half a cc of Perlane per lower chin jawline pre-jowl complex. And even at 37, you can see that I've truly rejuvenated her, made her look fresher, feminine, and more youthful. Here's a 49-year-old. This was for a little local TV show. And this is, again, the standard, 1 Restylane per side, a half a Perlane per cheek. And where I target, remember, here's a couple things that are interesting. Do you see how, this is the illusion. Do you look at her upper eyelid? It looks heavy to you, right? It looks heavy because it's not balanced with the mid-face. So oftentimes, when I try to do fillers, I want to create a maximal result at minimal cost. And so I target critical zones, I call them, which are lower eyelid, anterior cheek, pre-jowl. And that's about it. If you look at that, it looks more rested. And if you even look back here, I'm almost done, guys. About 1 minute here. The upper eyelid was not done, it was just filled. And if you look at it, it's a softer look. It's balanced. I mean, of course she needs some work on the upper eyelid, but it's not bad for just having done that. We are, I think, done. So, and I also use only cannulas. One small thing that I do is when I do this, I do it completely different from fat grafting. Fat grafting, I inject lateral medial because they're lying down. When I do my cannula techniques with fillers, I go medial lateral. That minimizes bruising. That it basically, really virtually eliminates intra-arterial injections or intravascular problems. And it also allows me to get smooth results that I can put in 4 syringes in less than 2 minutes. Consistently done with my block in 10 minutes in and out. So it's a very, very smooth result. That's the book I wrote, and yes, I get some royalties from it, but about probably $3 a book, but there it is. And if there's any questions everyone wants to ask me, if we're on time, I can answer them. If not, you can just email me at drlam@lamfacialplastics.com. Thank you for your attention.